Hi everyone, it's Derek here from AduMed. So welcome to today's video based on osteoporosis. Now there's so much you can learn about osteoporosis. I thought to myself, let's keep it really simple. Let's look at the assessment of patients that present with this condition. So specifically we'll look at three main things. We'll look firstly at the assessment of patients' fracture risk. Second, we'll look at the details about the FRAX score itself. And lastly, we'll look at the assessment of patients' bone mineral density. So with that and more, let's dive straight in. So we can call something a fragility fracture if the patient sustains a fracture following a fall from a standing height or even less. Now in osteoporosis, these patients have a low bone mineral density, so they're more likely to get these fragility fractures. Under NICE guidance, the FRAX score can be used to assess fracture risk. We should assess fracture risk in postmenopausal women and men aged 50 and older with certain risk factors. So if you've watched any of my videos so far, you know that I like to break lists into categories. This makes it easier for me to remember. So our osteoporosis risk factors can firstly be grouped into those related to fracture history, such as a history of hip fracture in parents or a previous fragility fracture, including vertebral fracture. Secondly, we can look at those risk factors related to drug and social history. So this includes the use of current oral steroids if taken for more than 3 months, and also the patient is a current smoker and has an alcohol intake of 3 or more units per day. And lastly, we can look at risk factors linked with past medical history. So here we look at things like a BMI of 19 or less, and also secondary underlying causes of osteoporosis, such as untreated hyperthyroidism, rheumatoid arthritis, and also other conditions. Certain medications are more likely to lead to osteoporosis. So some examples include steroids, PPIs, antiepileptics, and SSRIs. So I'd now like to discuss the FRAX score. So this is a risk score that is used to determine the 10-year probability of having a fracture in patients that have the risk factors we've already discussed. So possible outcomes following a risk assessment using the FRAX score include lifestyle advice if our patients are at a low risk, measurement of bone mineral density if our patients are at an intermediate risk, and also thinking about commencing treatment if our patients are at a high risk. Now moving on to the investigation of this condition, we know that bone mineral density is measured using a DEXA scan, and the femur is the usual anatomical site for making this diagnosis. So we can diagnose osteoporosis if the T-score is less than or equal to -2.5. A T-score of more than -1 is normal, and a T-score between -1 and -2.5 is defined as osteopenia. Now current guidance suggests that we should consider doing bloods in these patients, so we can think about a full blood count using these TFTs, LFTs, bone profile, CRP, and ESR. Also other investigations may be indicated, but this is based on a clinical picture. So I'd like you to gain as much confidence as you need to apply all your knowledge in a practical way. So make sure you check out our case study playlist, which contains all the information you need to build on this skill. Thank you so much for watching today's video. Don't forget to like and subscribe, and I'll see you soon.